Hi, did you know that the latest UN climate report is called Atlas of Human Suffering? Worse and bigger? We're looking through a climate catastrophe. And we're going to talk about how virtual care and digital healthcare is going to be essential to provide services both in the developing and the developed countries. Hi, I'm Junaid. I'm neurocritical care stroke and epilepsy specialist, and I'm excited about digital healthcare and virtual care. And this is the other series of lectures that you're going through the YouTube and the courses that we are developing from developed countries and developing countries. So let's talk about it. As you can see, we are actually having worsening forest fires in our midst. We are actually experiencing a climate catastrophe that has never been seen before. We have seen more and more droughts that are coming, and we have seen more and more people that are suffering with flooding as well. So we are actually living through extremes of weather, which is definitely impacting humanity as a whole. So let's talk about where we are as far as climate is concerned. As we can see that we are actually already have a significant amount of carbon dioxide in our atmosphere. Parts per million is approximately 419, and we are looking at a global rise in temperature at 1 degree. At 2 degrees, we are thinking about a complete extinction event. And the sea level has already increased by 4 inches. This is huge. If we have to sustain the planet, we have to make sure that we take all precautions to make sure that we are working towards, as a humanity, to make sure that the climate change is not an extinction event for us. So, where does virtual care comes in this regard? Actually, before we move into it, I just want to show you a little bit more example, like where we're seeing the significant amount of droughts that are going to be impacting us in the near future. As you can see on this Lake Mead example, which is in near Nevada and Arizona, we are experiencing severe droughts. The levels of that lake has never been this low in centuries. And now we're seeing drought warnings. Even where I'm living here in Prosper, Texas, there was a warning in the last 2 weeks not to water your garden because of the drought warnings that are going in Texas. And this is not just a Texas problem, this is an all over United States problem. As a matter of fact, the western corridor all the way from Washington to California has been in severe drought practically for the last 15 years, and it is going to get worse. And there are actually policymakers who are extremely worried about how we're going to supply water to our population here in US. Let's not talk about Karachi, or developing countries where there has been a significant amount of issue to get clean water for a long time. As you can see in this example, there is clearly a lot of, this was supposed to be how it was, and now as you can see, this is where we are. So significant drought has been affecting us as a whole, and this is going to be a big issue moving forward. Interestingly, the cost of climate change will be borne by the developing countries more so than developed countries. Because the poorer your country is, the less likely it is able to adapt to the climate change realities. And unfortunately, the poorest countries of the world are going to be the most who's going to be suffering from this climate change effect. The worst of them is, for example, Bangladesh. Bangladesh is going to be underwater 50% of the country in the next 50 years by 2050 if we don't do anything about it. And this is not unusual. As a matter of fact, the top 7 countries that are going to be affected are developing countries. As we look through this map, but this is actually an older map from 2014, and the term we use is potential vulnerability to climate change. And you can see India, Pakistan, Bangladesh, Philippines, Indonesia, Malaysia, these are the countries who are the most vulnerable. And there are updated maps who have actually now impacted the countries like United States, UK, Belgium, etc. will be impacted, and therefore their crops, their way of life will also be significantly impacted. Interestingly, as we can see that we are going to see a significant amount of improvement. Interestingly, there have been studies that have been done, for example this one, Kaiser Permanente, that the impact of telehealth on environment, and they did a 5-year analysis on outpatient setting in the Pacific Northwest, and they found out that shift to telehealth helped dramatically reduce the amount of greenhouse gas. Clearly, if you're not going to travel the car all the way to the clinic, that itself is huge, but that's not it. The amount of buildings that you have to maintain, the electricity, the heating, the cooling, the amount of manpower that is needed. Because if just one patient goes in, then there's a nurse, then an occupational therapist, there's an office manager, there's a physician. All of these people have to travel, even for just one patient. So what we're seeing is that there is a dramatic decrease of greenhouse gas emissions just by moving towards telehealth, especially in the outpatient setting. And that's where the real crux of the matter is. We're going to talk about in the next few lectures, where we're going to talk about how hospitals are going to become virtual, and we're going to think about hospital at home, and that will also bring more further improvement in terms of greenhouse gas emissions. But I don't know if there's going to be needed a proper study, because sometimes you have to travel more for these patients, even if they're at home. For example, the labs need to come to their home, or imaging need to come to that home. So I don't know how much that impact will be. At the end of the day, from an outpatient setting, there is no confusion that this will be significantly better for the environment. If you go down, as you can see, that this was the actual study that was done from 2015 to 2020, and this is the conclusion. Increasing telehealth use in an integrated health system, especially in the North Pacific region of the United States, corresponded to dramatic decrease in ambulatory visits of carbon intensity. And this is something that we should be aware of, and this is something we should aspire for, not just for each of us, not just individuals, but humanity as a whole. Of course, when you do a systemic review, the idea is that you are unable to get all of that impact because the studies are so varied in terms of their outcomes, and then it's really hard to standardize those studies into one group. However, replacing physical visits with telemedicine appointment resulted in significant 40 to 70 time decrease in carbon emissions. Factors such as meeting duration, bandwidth, and use rates influence emissions to various extents. According to the lower bound scenario, telemedicine becomes a great choice at a distance for a few kilometers when the alternative is transported by car. So as I said, even if you look at this particular study as well, you're going to see that the carbon footprint for telemedicine is going to be hugely beneficial for us as humanity and for everyone else. Thank you so much for listening to today's lecture. We're going to go ahead and talk about personal impact on telemedicine and how it is important in our next lecture. Thank you.